My name is Penelope Guccione. I'm a family nurse practitioner. I work in the endocrinology department. I've worked at Cornerstone for 7 years, and I have a passion for diabetes. So there are three main types of diabetes: type 1, type 2, and gestational diabetes, meaning diabetes during pregnancy. Type 1 diabetes is thought to be caused by an autoimmune reaction, which is the body attacking itself. This reaction stops your body from making enough insulin, and it's usually diagnosed in childhood or young adulthood, though it can also be diagnosed at an older age. There's type 2 diabetes, which is the most common, and that's when your body doesn't use insulin well and can't keep blood sugar at normal levels. It's usually diagnosed in adults, but can also, and we've seen an increase in this recently, be diagnosed in children and young adults. Type 2 diabetes can be prevented with healthy lifestyle choices, such as eating a low carb diet, maintaining a healthy weight, and being active every day. And then the third type, gestational diabetes, develops in pregnant women. Gestational diabetes usually goes away after your baby's born, but it does increase your risk for type 2 diabetes later in life. It also increases your child's risk of type 2 diabetes later in life. So again, we have type 1, type 2, and gestational diabetes. And it's also important to mention pre-diabetes, which 1 in 3 Americans have, and about 80% of them don't even know it. There are many short and long-term effects of diabetes. Short-term, such as life-threatening condition known as DKA. Long-term, the ones we hear most about: heart disease, stroke, vision issues such as blindness, wounds, kidney disease, nerve damage, and many other detrimental things. So 37 million people in the United States have diabetes. About 10% of those people are type 1 diabetic, and about 90% of those people have type 2 diabetes. Also, like I mentioned before, and very important to know, about 1 in 3 Americans have pre-diabetes, and 80% of them don't even know it. In the last 20 years, the number of adults diagnosed with diabetes has more than doubled in the US. Those at risk for diabetes are those with a family history, those who are overweight or obese, those who are not physically active, those who are pre-diabetic, those who have had gestational diabetes. The number one risk factor for developing type 2 diabetes is an unhealthy diet high in processed foods, particularly carbohydrates. The most common signs of an undiagnosed diabetes are increased thirst, increased urination, increased hunger, losing weight without trying, blurry vision, numbness or tingling in your hands or feet, and just overall sluggishness and tiredness. You can prevent diabetes and lower your risk for it by eating a healthy diet, number one, exercising for at least 30 minutes every day, and maintaining a healthy weight. And like I mentioned before, avoiding processed foods and sugary drinks. If you learn that you have diabetes, if you're diagnosed with diabetes, you should seek medical attention right away and maintain a very close follow-up with your provider, usually every 3 to 6 months. Number one is changing your diet, taking any medications that are prescribed by your provider every day, and adding exercise into your daily routine. Your blood sugar is slightly elevated and showing an increased risk of developing type 2 diabetes. The hemoglobin A1C is the gold standard blood test for diagnosing prediabetes and diabetes. If that number is between 5.7 and 6.4, you are considered pre-diabetic. If that number then increases above 6.4, you are considered type 2 diabetic. Usually your primary care provider will be the one to order this blood work. Pregnant women will also be screened for gestational diabetes by their OB. Very close follow-up with your provider every 3 to 6 months, generally with blood work. Arguably, most important next step would be at home, making changes to the way that you eat and adding in daily movement or exercise. And it doesn't have to be anything complicated. Even just a walk every single day for 30 minutes is a great start. I know that diabetes can be a very overwhelming diagnosis, but it doesn't have to be the end. We have many cases of reversing type 2 diabetes here at Cornerstone through proper diet, proper lifestyle modifications, adding in exercise. So it is definitely possible, and it is not always the end of the road.